Embolism of mandible most commonly arises from site of second molar. Fat embolism is seen in none of these. Adventitious bursa is found over bony prominences. Prolapsed intervertebral disc PID is most common at prophylactic antibiotic systemic therapy is indicated in hip knee joint prosthesis, extremities, vascular surgery, small or large bowel surgery. Which nerve is with good prognosis? Radial nerve. A 64-year-old hypertensive obese female was undergoing surgery for fractured femur under general anesthesia. Intraoperatively, her end tidal carbon dioxide decreased to 20 from 40 mm of mercury, followed by hypotension and oxygen saturation of 85%. What could be the most probable cause? Fat embolism. The movement at the following joint permits a person to look towards the right or left. Atlantoaxial joint. The management of fat embolism include all of the following except direct pressure and elevation. So the management of fat embolism includes oxygen, heparinization and low molecular weight dextran. Principle of treatment of pyogenic infection of skeletal system are antibiotics. Tennis elbow is characterized by tendinitis of common extensor origin. An 8-year-old boy presents with a gradually progressing swelling and pain since 6 months over the upper tibia. On X-ray, there is a lytic lesion with sclerotic margins in the upper tibial metaphysis. The diagnosis is Brody's abscess. Allen's test is useful in evaluating integrity of palmar arch. Pelvic fracture is associated with extraperitoneal bladder rupture. Nervous system, signs of cerebral compression are all except hypotension. So which are the signs of cerebral compression? Bradycardia, papilloedema and vomiting. Surgery is not useful in cerebral edema. In a patient with head injury, black eye associated with subconjunctival hemorrhage occurs when there is fracture of floor and anterior cranial fossa. Plexiform neurofibromatosis commonly affects trigeminal nerve. The commonest extradural tumor is metastasis. Patient with a history of fall presents week later with headache and progressive neurological deterioration. The diagnosis is chronic subdural hemorrhage. Commonest site of meningocele is lumbosacral. In causalgia, the nerve most commonly affected area is median and sciatic. Plexiform neurofibromatosis commonly affects the fifth nerve. The treatment of post-traumatic epilepsy is long-term anticonvulsant. Following are the features of raised intracranial tension except tachycardia. So which are the features of raised intracranial tension? Altered sensorium, papilloedema and convulsion. Facial nerve palsy is seen in the following fracture: middle cranial fossa. Lowest incidence of cerebral tumor is seen in occipital. Commonest orbital tumor causing exophthalmos is glioma. Musculoskeletal abnormality in neurofibromatosis is hypertrophy of limb, scoliosis, cafe-au-lait spots, and pseudoarthrosis. Dumbbell tumor is seen in neurofibroma. Scalp hemorrhage is best controlled by pressure. Tinel sign indicates regeneration of nerves. The most important clinical finding in a case of head injury is level of consciousness. Management of extradural hemorrhage is immediate evacuation. Lumbar sympathectomy is done for rest pain, then skin ulceration, and then gangrene foot. So rest pain is the most appropriate answer. Bilateral phrenic nerve palsy is caused by polio. The nerve of Kunz is an important landmark in cervicodorsal sympathectomy. Features of extradural hemorrhage include all except severe hypertension. So which are the features of extradural hemorrhage? Deteriorating consciousness, fixed dilated pupil on the same side, fracture line causing the temporal bone. A dome-shaped skull with a high forehead in the infant with slight hydrocephalus, Olympian brow, is seen in congenital syphilis. After an open injury, the optimum time for nerve suture is when wound is free from infection. Brain abscess may be due to following: chronic suppurative otitis media, chronic lung abscess, or trauma. Immediate surgery is indicated in extradural or subdural hemorrhage. A 1-month-old female child has swelling over the back and the sacral region. There is no cough impulse on the swelling. X-ray examination shows erosion of the coccyx. The most likely diagnosis would be sacrococcygeal teratoma. Commonest cause of carpal tunnel syndrome is pregnancy. An elderly man who has had a trivial history of head injury 3 months ago develops headache and turns unconscious. On examination, he is found to have fixed left dilated pupil and right hemiplegia. What is the most likely diagnosis? Chronic subdural hematoma. Sympathectomy is not useful in intermittent claudication. In neuroblastomas, the most common presentation is lytic lesion in skull with suture diathesis. All produce carpal tunnel syndrome except Addison's disease. So, which are the diseases causing carpal tunnel syndrome? Cody's fracture, acromegaly, and hypothyroidism. Most common cause of subdural hematoma is rupture of superior cerebral vein. Commonest spinal tumor is neurofibroma. In patient of head injuries with rapidly increasing intracranial tension without hematoma, the drug of choice for initial management would be 20% mannitol. Neurofibromatosis presents as all of the following except lymphadenopharynx. So neurofibromatosis presents as elephantiasis neuromatodes, plexiform neuroma, or von Recklinghausen disease. Which of the following is primary neurogenic tumor? Neuroblastoma. Glioblastoma multiforme may occur in the following except adrenal medulla of child. So glioblastoma multiforme may occur in cerebrum of adult, brainstem of child, and spinal cord of adult. The parasitic infection capable of producing spinal cord compression is echinococosis. The following are CNS finding of CO2 narcosis, decreased pH of CSF. Peripheral nerves can withstand ischemia up to none of these. Commonest intramedullary spinal tumor is ependymoma. Battle sign is seen in fracture of middle cranial fossa or fracture of base of skull. Premature filling of vein is a manifestation in cerebral angiography of arteriovenous malformation. In normal pressure hydrocephalus, seen are all except convulsion. So in normal pressure hydrocephalus, ataxia, dementia, and incontinence are seen. Lucid interval is seen in extradural hemorrhage and intradural hemorrhage. Esthesioneuroblastoma arises from olfactory nerve. Earliest feature of sudden increase in intracranial tension in infant is papilloedema. Neurofibromatosis is associated with pheochromocytoma. Meningomyelocele patient after being operated developed hydrocephalus due to Arnold-Chiari malformation. Extradural hematoma is associated with what percent of severe trauma? 10%. Most common presentation of intracranial aneurysm is intracranial hemorrhage. Opsomyoclonus is encountered as clinical feature of neuroblastoma. The CNS tumor present with calcification is oligodendroglioma. Psychiatric symptoms true except more common with slow growing and more with brainstem lesion is false. Psychiatric symptoms are more common with supra than infratentorial tumors and more with temporal than frontal lobe tumors. True about hemangioma of head and neck, they are very common. Sturge-Weber syndrome is seen and high output failure. Supracellular calcification with polyuria is seen in craniopharyngioma. A person develops altered sensorium following headache and vomiting. The diagnosis is subarachnoid hemorrhage. Neurosurgical treatment of epilepsy usually involves removal of epileptic focus from which lobe? Temporal lobe. All of the following conditions are known to cause diabetes insipidus except multiple sclerosis. So head injury, histiocytosis, and viral encephalitis causes diabetes insipidus. Best treatment of subdural hematoma in a deteriorating patient is surgical evacuation. Which one of the following is the most common site of Barry aneurysm? Anterior communication artery. The most common neurological abnormality that occurs with head injury is altered consciousness. Vidian neurectomy is indicated in vasomotor rhinitis. The following methods are used to lower the intracranial pressure in patient with head injury except administration of nifedipine. So what are the treatment methods used to lower the intracranial pressure? Hyperventilation, administration of mannitol, and hypothermia. A person has been brought in casualty with history of road accident. He had lost consciousness transiently and then gained consciousness but again became unconscious. Most likely he is having brain hemorrhage of extradural. The earliest manifestation of increased intracranial pressure following head injury is altered mental status. The most preferred approach for pituitary surgery at the present time is transsphenoidal. Which of the following will manifest as patchy meningitis hemorrhagica interna subdural hematoma? Chronic subdural hematoma refers to collection of present for a period of 21 days. Thickened peripheral nerve are seen in all of the following conditions except diabetic neuropathy. So thickening of peripheral nerve is seen in Hansen's neuropathy, amyloid polyneuropathy and Refsum's disease. Lucid interval is classically seen in extradural hematoma. A 20-year-old male come to casualty with head injury. Examination reveals normal consciousness, clinically normal, and blood in the tympanic membrane. Most likely the cause is complete basilar fracture. Durate hemorrhage is seen in brain. A 45-year male presents with abrupt onset of pain, weakness, loss of contour of shoulder, and muscle wasting on 5th day of tetanus toxoid immunization. Likely cause is brachial plexus neuritis. A patient presents with sudden headache and vomiting and unconsciousness. The diagnosis is subarachnoid hemorrhage. In a patient with head injury, black eye associated with subconjunctival hemorrhage occurs when there is fracture of floor and anterior cranial fossa. In patient of head injuries with rapidly increasing intracranial tension without hematoma, the drug of choice for initial management would be 20% mannitol. Durate hemorrhage is seen in brain, which is an ominous sign in case of severe head injury, anisocoria and decorticate posturing. About cranial trauma, false is raccoon eyes seen in subgaleal hemorrhage is false. What is true is depressed skull fracture is associated with brain injury at the immediate area of impact. Corticovenous fistula occurs in base of skull fracture. Post-traumatic epilepsy is seen in 15%. A patient with head injury opens eye of painful stimulus, used inappropriate word and localizes pain. What is his Glasgow Coma Scale score? 10. In a head injury victim, which of the following is the most common initial manifestation of an increasing intracranial pressure? Change in the consciousness level. Cleft lip and cleft palate. Heinz pharyngoplasty is used to improve a child's speech.